In this lecture, we will learn all about behavior therapy. Behavior therapy also is called behavior modification and cognitive behavioral therapy. Behavioral therapists occasionally distinguish among the terms, but the distinctions are not standard. Behavior modification originally referred to procedures that change the consequences of behaviors, such as reinforcement, and the stimulus conditions that elicit behaviors, such as the physical setting. However, behavior modification sometimes is used as a generic term to refer to any procedure that modifies behaviors. The term cognitive behavioral therapy specifically refers to treatments that change cognition, such as thoughts and beliefs, that are influencing psychological problems. Behavior therapy is the broadest and purest term, and we will use it to refer to the entire field of therapy that you are going to be learning about in my lectures. The major goal of behavior therapy is to help people with psychological problems. It is also used for a variety of purposes, including to improve everyday functioning, work productivity, child rearing, dealing with societal problems, enhance athletic performance, reduce perfectionism, relationship issues, marital and family problems, and to prevent and treat the physical and psychological effects of mental disorders. Now, when trying to define certain terms of behavior therapy, we must realize that there is no single agreed upon definition of behavior therapy. There are 4 defining themes that are at the core of behavior therapy: scientific, active, present focus, and learning focus. These themes are interrelated and overlap in their influence on the practice of behavior therapy. Let's dive into the first one more in detail. Scientific. The essence of behavior therapy is a commitment to a scientific approach that involves precision and empirical evaluation. All aspects of behavior therapy are defined precisely, including the behaviors targeted for change, treatment goals, and assessment and therapy procedures. Treatment protocols that spell out the details of particular therapy procedures have been developed for a number of behavior techniques. Now, active. In behavior therapy, clients engage in specific actions to alleviate their problems. In other words, clients do something about their difficulties rather than just talk about them. Behavior therapy is an action therapy, in contrast to a verbal therapy such as psychoanalysis or client-centered therapy. In verbal therapies, the dialogue between the client and therapist is the major mode through which therapy techniques are implemented. In action therapies, conversations between the client and therapist are predominantly for exchanging information. Therapy itself primarily consists of tasks the client does. Moving on to present focus. The focus of behavior therapy is in the present. Behavior therapists assume that clients' problems, which occur in the present, are influenced by current conditions. Accordingly, behavioral assessment focuses on the client's current rather than past circumstances to find the factors responsible for the client's problems. Then, behavior therapy procedures are employed to change the current factors that are affecting the client's behaviors. This emphasis contrasts the other types of psychotherapy, such as psychoanalytic therapy, which assume that the major influences on clients' problems resides in the client's past. Now, in learning focus, an emphasis on learning is a final theme that defines behavior therapy and distinguishes it from other types of psychotherapy. Learning is important in three different respects. First, the behavioral model holds that most problem behaviors develop, are maintained, and change primarily through learning. Behavior therapists do not believe that all behaviors are primarily a function of learning, because some behaviors are strongly influenced by hereditary and biology. Nonetheless, virtually all behaviors are affected by learning, even if they have biological components. Second, behavior therapy provides clients with learning experiences in which new or adaptive behaviors replace old, which is the maladaptive behaviors. Thus, there is a strong educational component in behavior therapy, and behavior therapists often serve as teachers. And third, the development of some behavior therapies was originally based on basic learning principles and theories of learning such as classical and operant conditioning. Behavior therapy is not a single technique. We have to remember that, okay? There are many different forms of behavior therapy. In other words, many behavior therapies. These therapies are unified by the defining themes and common characteristics that we're going to be learning about. The following examples illustrate the variety of behavior therapy procedures that exist. Self-instructional training, modeling and behavior rehearsal, response costs, positive reinforcement, stress inoculation training, extinction and differential reinforcement, systematic desensitization, token economy and shaping, cognitive behavioral couple therapy, cognitive reconstructing, and acceptance and commitment therapy. Behavior therapy has a long past, but a short history. In rudimentary forms, behavior therapy is very old. Humans have been using behavioral principles to modify people's behaviors for thousands of years, such as parents rewarding children for good behaviors. Although these everyday applications are generally haphazard, they can be effective. To treat serious problems, a systematic approach is necessary. The formal systematic application of behavioral principles to treat psychological problems, that is, behavior therapy, is about 80 years old. Now, to contrast the difference between behavior therapy and some other therapies out there, let's talk about the differences between psychoanalysis and behavior therapy. First, we will talk about the locus of time. In psychoanalysis, they focus on past experiences. In behavior therapy, the focus is on present circumstances. Mode of treatment. In psychoanalysis, it's a verbal approach. In behavior therapy, it's more action-oriented. Treatment strategy. For psychoanalysis, indirectly explore the client's past and unconscious as related to the client's problem. In behavior therapy, we identify and directly change present maintaining conditions of the client's problem. How techniques are applied. For psychoanalysis, it's the same for all clients. In behavior therapy, we customize for each client a different approach. The length of treatment. How long do clients stay in treatment? For psychoanalysis, it's a very lengthy process. It could be a year, 2 years, 40 years, 50 years. For behavioral therapy, it's brief, anywhere from 6 to 8 sessions to 6 months. And in regards to evidence for effectiveness, for psychoanalysis, it is uncontrolled. Qualitative case studies are used. For behavior therapy, it is controlled, and quantitative experiments are preferred. In my next lecture, we are going to dive into the behavioral model. Why are we the way we are? And why do we behave the way we do? It's going to be very exciting. I'll see you then. Bye-bye.